The National Psoriasis Foundation warns that delayed care and lack of awareness may put millions at risk for psoriatic arthritis, obesity, diabetes, and high blood pressure. Joining us today is Dr. Tina Butani to discuss the signs of psoriasis and why it is important to talk to your doctor. And we're also joined by a psoriasis patient, mother, and advocate, Takia, who is here to share her firsthand journey with the disease and her mission to bring awareness to other patients like her. Thank you both for being with us today. We appreciate it.
Thank you for having us.
Now, doctor, tell us about the signs of psoriasis and why the disease is misunderstood.
Yeah, so psoriasis presents most commonly on the skin with red, scaly plaques of involvement, most commonly in areas like the elbows and knees. But if psoriasis gets out of control, it can really impact any part of the body, areas like the scalp, the trunk, even the genital and hidden areas of the skin. I want people to understand that psoriasis is not just a skin disease, it's actually a chronic inflammatory medical condition. And so the inflammation that causes psoriasis actually starts from within the body. And if we let that psoriasis inflammation go unchecked, it can lead to other serious medical conditions, things like heart disease, diabetes, even increases the risk of certain types of cancers. So I want people to understand that this is not just a skin disease, this is a really serious medical condition. I also want people to know that psoriasis is not contagious. So you can't catch psoriasis just by touching someone or interacting with them. And I think this is really impactful for patients living with this disease because they have to constantly explain that, their skin disease is not harmful to others. So I want people to understand that this is not contagious.
Can you talk about the health disparities among minority communities?
Yeah, so unfortunately in minority communities, psoriasis is more likely to go underdiagnosed. So minorities living with this disease might have it and not even know. And there's many different factors that contribute to this. It might be due to lack of access to specialists like board certified dermatologists or lack of insurance coverage for the treatments that we have. Minority patients are also more likely, once they get to the doctor, they're more likely to present with more severe disease.
Takia, can you tell us about your story?
Sure. So my my journey with psoriasis began in 2016 on the severe level. However, some years prior to that, I am sure that I had it in a mild aspect on my scalp. I took psoriasis, my psoriasis experience when it got severe, and I educated myself after being diagnosed in the hospital, and found my lane of education and research on it and started advocating for myself so that by the time I got to my primary doctor, my primary was very helpful because I had information for her. She had information for me. She sent me to see specialists. I got in with a good specialty team and we figured out the best options for me because I didn't know how severe that psoriasis could be. It affected, again, from head to toe parts of my body. And I would just like to advocate more and spread more awareness to the unaware that even if you have mild psoriasis, to make sure that you're asking the questions and getting the help that you need before it gets worse.
And where can we go for more information?
Yeah, anyone can go to psoriasis.org/infocus to learn more about this disease.
Thank you both for being with us today. We really appreciate it.
Thank you for listening.